Uh, my name is John, and I'll be presenting my community assessment analysis, the community of Trinity in Pasco County. So this is the map of the entire community. So for its historical overview, so basically this place is part of the city of Newport Richey. So it is a land settlement, mostly farmlands, that we can predate back to the early 1920s. And the first settlers were from Alabama, Carolina, Missouri, and the Georgia states, which were looking for large areas to grow their crops on. And it is not until around 1980s where houses, like subdivisions were built. And from then on, nothing really has changed that much. And up to now, it's still mostly farmlands, like 70-60% of it. And then in the early 1990s also, aside from homes being built, they kind of like incorporated golf courses within it. So that's the only changes that have made. So golf courses slash homes will build. So it's like there's 10 of them right now in this community. And for the latest population census, it is around 10,987. And mostly people here drive their cars to work. And it's Dr. James Gillis who was the prime developer of this community and got his name from the Trinity College of Florida. With regards to the community structure, so it has actually met most of the residents' basic needs, like access to supermarket. Though it's again is a small kind of town, but they have everything in there, like healthcare, basic commodities, and basic utilities. So services such as hospice care is also available, assisted living for the elderly, behavioral health, walk-in clinics, for general wellness are pretty much available in this community. And in addition to this community has been looked out by the Pasco County Sheriff's Office, District Number 3, with its counterpart, the Fire Department and EMS Service, keep an eye of them 24/7. And with regards to community structure issues, again, as mentioned earlier, this is still a suburban area, mostly, again, 60% is farmland. And one of the challenges is the public transportation. It is the availability of the schedules are pretty much limited. So people has to be, or residents who doesn't have car trying to commute out of this community has to be keen of the schedule, because if you miss one, then the next trip will be in the next 2 to 3 hours. So that's the only challenge here. And one thing also is a challenge in this community is the school structure. In this community, there's limited amount of schools. There's only one college within. So if you want to go for a better college, you have to either go to Tallahassee or to Gainesville or somewhere in Tampa, and you have to drive in Tampa about 20-30 miles. And the same thing with the BPKs and daycare centers. They don't have much in this community. And one thing that I have to highlight also is the unavailability of magnet schools, because if you have really smart children and want them to be better at schooling, so again you have to drive all the way to Tampa or maybe down into the mid Pinellas area to avail of these magnet schools. And another thing also are the churches in this community. Churches are mostly Baptist, so if you're a Catholic or if you're not Jewish faith, and for example, if you're an Islamic, believer, so again, you have to drive all the way to Tampa, or either to the Mid Pinellas or South Pinellas region to avail of those services. And with regards to the population, it is actually their population is well balanced. Like 40% of it are 65 and older, and the other 40% are 64 and below, and the remainder are mostly children under 5. And with regards to gender delineation, about 55% of the community are women. And with regards to race, 90% of the population are predominantly Caucasian. With regards to health concerns, comparison of this community, in comparison with the state or with national, as presented here from the Nursing Journal, being authored by Kotler, it states here that nationwide, or statewide is similar. Cardiovascular disorders rank first, diabetes second, cancer and pulmonary. And then for this community, it is a slight difference because COPD or lung cancer is ranked first, heart problems second, stroke third, sepsis and infection, so respectively. So what does it tell us? That this data is indicative of the unhealthy habits, probably smoking, recreational drug abuse, and unsafe health practices by some of the residents. So that's what the data is telling us. And when it comes to sources availability, there are readily available health related resources in this community. As I mentioned earlier, again, the big one is the Medical Center of Trinity and the behavioral health right at the heart of this community. And again, if you want some wellness clinics, we have walk-ins like the Minute Clinic and Family First. And again, the only issue here are those homeless individuals being discharged out of the hospital, and how can they access those prescribed medications. And we also have a wonderful community health center that can cater, again, most of the indigent patients and probably some of those homeless, but to a certain limited amount of resources. And when it comes to Healthy People 2020 outcomes, we have to choose 3. So my choices are, with regards to this community, first is again substance abuse, because this is very predominantly, an issue in this community. So again, as I mentioned earlier, patients have been coming in and out, the same patients with the same cases. So something has to be done, like campaign, education, maybe through the radio, TV, or some newspaper, and the government had needed to step up. Okay. Second one that I choose was mental health and cognitive disorder, because there's a healthy group of number of elderly population here with Alzheimer's, dementia, and the problem is some family members are having some unrealistic goals for their parents or their relatives. They think that, for example, if their parents have like in the end stage of Alzheimer's, dementia, they think that their that family member can still go back to where he was once, which is actually not happening or not the case. So again, we have to really educate those family members that dementia is a degenerative disease. So once we hit that end stage, so that's gonna be it. There's no more, cure for that one. And the last one that I highlighted here is the chronic disease self-management program. Okay, so disease like I've highlighted, for example, is diabetes. So for those patients suffering from it, we have to really educate them for them to better manage, okay, better control blood sugar, to avoid those nasty, infection, let alone your amputation, and of course, end of life. So those kinds of things. And with regards to the environmental analysis, so environmental resources are adequate for this community. So they have available safe and clean drinking water, sanitation, sewage disposals are kept. So your garbage collection is up to date. Again, there are a bunch of commercial corporations that are actually doing this garbage collection like bi-weekly in most of the subdivisions. And with the exception, of course, of those mosquito proliferation during summertime. And to summarize the environmental issues, so I put at the top of the list is flooding, because this area is very known for flooding, especially during rainy season. And what it does, it is ruined, all those roads and making some potholes, which are again kind of like, annoying when you try to travel. And again, there's your mosquito and bugs infestation again during rainy season. And I also noticed that over fertilizations of the lawns, be it commercial or residential, and the golf courses as well. So what it does is it leads to tremendous algae overgrowth on the sewer or the drainage system. And then what it does again, it will clog their drainage system, and then again the circle goes on and on. So the mosquitoes will be there, and again some of the stuff. And I just throw in also the seasonal red algae epidemic, the red tide, which is causing havoc in our Gulf right now. So when it comes to government and public policy, actually community of officials are readily available all the time. You have regular council meetings, which is actually most attended, as well as your town hall meetings. So budgets are channeled appropriately towards regular community operations. The only concern here, which is I think is true to everybody, is the promptness of the city council to act. An example that I put in here is just just a simple example of a broken sewage system, and it will take kind of like a long time for them to fix it. And another example also that I highlight here is those worn out back roads in those remote areas, which actually the city council are kind of like tend to take for granted, and those kinds of things. And when it comes to overall community needs and problems, so again I rank rampant illicit drug use and abuse is my top priority. So again, since 30 to 40% of admissions at the medical center of Trinity is sepsis-related infection brought about by substance abuse cases. And again, those same patients keep on coming back, back and forth. And I also put in tobacco and alcohol abuse, since COPD is the second leading medical condition causing hospitalization in this community. So it has to be, something has to be done about it. And then heart-related disorders, so related to unhealthy lifestyle, hypertension and heart problems are also rampant cases. And you have your diabetes that we mentioned earlier, again causing those amputations and infections. And I just throw in also some homeless individuals, since this is kind of like a complex problem. So probably more of a choice that they make. And then finally, overall sanitation and cleanup on the community. And I think that's the end of my presentation, and this is my references. And thank you very much.